The menopause is when you stop having periods, and that's because your ovaries stop releasing eggs, which means in turn that your estrogen levels start to drop. The average age in the UK is 51, but you can go through it, most people, between the ages of 45 and 55. If it occurs earlier than the age of 40, that's known as premature menopause or premature ovarian insufficiency, which occurs in around 1 in 100 women. We don't know why it occurs, but we think there might be a genetic link. The lead up to the menopause is known as the perimenopause, and in that time your estrogen levels are starting to decline. It can happen anytime between several weeks before starting the menopause to several years before starting the menopause. And the symptoms can be similar to that of the menopause itself. That can include signs and symptoms of hot flushes, night sweats, low mood and anxiety, loss of libido, vaginal dryness, joint aches and pains. But the level to which people suffer these symptoms can vary significantly. We don't often need to do any tests to diagnose the menopause. It's usually diagnosed based on those symptoms, but if you are under the age of 45, your doctor may want to do blood tests to check your hormone levels. There are a number of treatments for the menopause, and they can usually be categorised into lifestyle measures, over-the-counter treatments, and prescribed treatments. In terms of lifestyle, firstly, we know that muscle mass can be affected during the menopause, and it tends to decline. That therefore means that the amount of calories that you need to intake often declines associated with that. So it is important to try and manage your weight and keep an eye on your weight, as it can slowly creep up. One way to manage that is through physical activity. We also know that doing resistance training like weightlifting can also improve your muscle mass again, and that exercise is integral in managing sleep and mood disturbances associated with the menopause. Furthermore, being overweight can increase your severity of hot flashes. In addition to muscle mass declining, your bone density can also decline during the menopause. So it's important that you have a diet with enough calcium in it. Calcium can be found in most dairy products and fruits and vegetables. It's also found in many fortified cereals. Caffeine, smoking, spicy foods and alcohol are all known to exacerbate hot flashes, so one might find that by cutting these out altogether, or at least reducing them, your severity of hot flashes and the frequency of hot flashes may also improve. Cognitive behavioural therapy, a form of talking therapy, has also been found to improve the symptoms of low mood, sleep disturbances, and even help manage the impact that hot flashes can have. And finally, for some, simple measures like keeping your house cool, having a fan nearby, wearing cool clothing, taking cold showers, drinking cold drinks may be enough to manage some people's hot flashes and night sweats. In terms of over-the-counter treatments, we know that not only is calcium important in our bone health, but so is vitamin D. But unfortunately, we don't tend to get enough vitamin D from the sunlight, especially during the months of October to March in the UK. And therefore, it is advised that everyone in the UK does take 10 micrograms of vitamin D during those months. To manage the vaginal dryness associated with the menopause, you can also buy over-the-counter vaginal lubricants and moisturisers. Finally, there are some herbal medication you can get over the counter which may help with hot flashes, including black cohosh and St. John's wort. However, these are unlicensed medications, and therefore the safety profile is unknown, and the actual contents can be unregulated. It's therefore not always recommended. In terms of prescribed medication, the most commonly prescribed medication to manage the menopause is HRT, hormone replacement therapy, and this can come in the form of patches, pills, gels, pessaries. There are a number of risks associated with HRT, namely the small increased risk of breast cancer. However, for many people, the benefits far outweigh the risks. However, it is important that you have a discussion with your practitioner about your individualised risk factors and whether it is safe for you. Another hormonal option for managing the menopause can be that of vaginal estrogens, which can help with the urinary symptoms, urinary tract infections, and vaginal dryness, and doesn't have the same increased breast cancer risks as other forms of HRT. Finally, there can be non-hormonal treatments to help manage hot flushes and night sweats. Now, this can include clonidine, gabapentin, and SSRIs, which are a group of medication that traditionally were used as antidepressants.